We just got done doing our January buyout. This group really needed our help, and thankfully, because of all the wonderful donations and support from our supporters, we were able to help these guys. There are still a few that we're pretty worried about, but we'll talk about them as we go through them. But these were a lot of older horses.
Oh man, buyout days are always really hard for our team. We got 21 horses today, and if you've watched the buyout videos before, Dr. Gina and I are just gonna go back and forth between. If you haven't met Nicole, Nicole is our new registered veterinary technician / hospital manager. We love her. She's amazing. I only work 2 days a week, so I wasn't here to do debriefing tomorrow. So we're squeezing in at the end of a super long day. So B25-1 was a 22-year-old thoroughbred mare. Her body condition score is about a 3 out of 9, and she had scarring on her vulva. She had crackles in both lungs. She was flaring her nostrils and had some really severe elevated noise in her trachea. And when I first saw her on the trailer, the first thing I noticed was that she had pretty significant respiratory distress. But she also was very lame on her right front leg, and I'm sure that they will show the radiograph in the intake videos, but she had an absolutely shattered long pastern. Just, I don't know how she was still walking. She did get pain meds. By the way, if we don't say that they got pain medication, if we said that a horse was painful, it got pain medication. So sometimes we forget to mention that. But it was absolutely one of the worst fractures I've seen, and it was months old. So she received the last act of kindness.
And the second horse that we looked at was B25-2. He was a 7-year-old gelding, bay with a star and some socks on his left hind and left front. His heart rate was in the 80s. So it did decrease a little bit to the upper 70s with Banamine. But he had support limb failure and his left front toe.
He was the one with the gist.
Yeah. So he had a fusion in his flexor tendon area and his hock and his right front carpus with digital pulses. And he just had some really bad looking hair coat. He had some feces matted into his fur and on his legs and scars on his withers. So he had complete failure of his suspensory apparatus in his left front. So after giving him pain management and checking him back out, he just was refractory to any kind of pain management. So medical last act of kindness was elected for him.
These are really depressing to watch, but we front load the most critical cases. So if you're watching for the first 10 minutes and you're like, do all of these horses get euthanized? They do not. But we do prioritize the worst cases. So B25-3 was a 13-year-old standardbred gelding. He was branded. His name was Pocket Change. I take that back. He was only 10. I aged him at 13. He was only 10 based on his brand. This poor boy was blind in both eyes. He had severe pain and entropion in one of his eyes with squinting and tearing. He had a big abscess on his right shoulder that you could smell from far away. And then he was painful on his right front, and left hind. He had difficulty walking even with pain medication on board. His heart rate only came down to 66. And we discussed as a team, and we didn't feel that he was a good candidate for bilateral enucleation, which is a really big surgery because he had so much going on elsewhere in his body and so much pain in his other limbs. And we gave him the last act of kindness.
B25-4 is a 10-year-old Tennessee walking horse mare. She's like a chestnut sorrel color with a nice little star. She was very wound up getting off the trailer because they had accidentally put her in the front with a stallion. And he was picking on her. So she was very reactive over her withers, and anything we did, the more you poked her with needles and things, she got really reactive. So we're going to give her time to decompress and check her out and see how she's doing. We're going to preg check her, get wither rads, and reevaluate her a little bit more closer after she has a few days or weeks to decompress and just kind of check her out. So today she got all the things.
And she had some nasal discharge.
She did have some nasal discharge, but her lungs sounded okay.
B25-5 is a 4-year-old grade stallion. He's the very naughty boy who was in with this other mare. He was extremely poorly behaved, which hopefully is just because he's a stallion, but he was biting and kicking and trying to jump things and mount things, and he's very wound up. He has a big scar in the left side of his face, and other than his eyes, his physical exam was normal, but he had his pupillary light response was present, but it was delayed in his left eye, and he has these kind of strange white inclusion bodies either on his lenses or in his posterior chamber of his eyes. Doing an opto exam in regular lighting without tools is hard enough, but then if you have a naughty stallion who's surrounded by mares and is yelling and not cooperating, we got a really inferior look at those eyes. So he is down for a full opto examination, and he also needs to be castrated.
B25-6 is a 28-year-old Belgian draft mare. She has a 4 out of 6 systolic heart murmur that you can hear on both sides of the chest. She has bilateral mature cataracts. She has pruritus and patchy hair loss. And so we had some concerns about her. We ran some blood work. She had some mild CBC changes, like decreased lymphocytes, which older horses, you expect those kind of immune cells, the circulating pool, to be lower. But her chemistry is what we're really worried about. She has elevated AST, GGT above the normal ranges, and those together show more of like liver insult. She also has really elevated total proteins, globulins, which also could be inflammation, liver, things like that. And her BUN is really high normal. It's like 24, and upper end of normal is 25. So we have really concerning changes on her chemistry about her liver. She's also a really poor body condition score. And so we have her down for cardiac ultrasound, dental exam, plus or minus float, and reevaluation.
B25-7, this guy was really heartbreaking. Was a little yearling Belgian colt, and I think the layman's term is windswept, but basically he had carpal valgus in one leg and carpal varus in the other leg. So basically his front legs should have been like this, and they were like this. This is a condition that is congenital. So he was likely born with this, and there are things that we can do to correct it, but the recommendation is stall rest for the first 2 to 4 weeks of life, and then pretty aggressive intervention after that. There are different things you can do. You can strip the periosteum, you can put braces, and there are things that you can do to correct. But the valgus, where the leg is kind of going out, has a pretty decent success rate, but only if you intervene early and aggressively. And the carpal varus, it's very difficult even with early intervention. And in this guy's case, we would have wanted to intervene at the 4 to 6 week mark, closer to that than close to a year of age. But unfortunately, he already had severe arthritis in the carpal varus knee. The left knee was already swollen and already had signs of irritation and chronic inflammation in that knee. So not only was that a surgery that Dr. Gina and I can't do, I don't think it's a surgery that a boarded surgeon would recommend trying. He had both legs affected, and he already had a lot of pain from arthritis, even as this young colt. So he was given the last act of kindness.
B25-8 was a 30-plus-year-old gelding quarter horse, bay. He had a 6 out of 6 holosystolic murmur that you could also hear more loud on the left, but holosystolic means you can hear it throughout the whole active systole. His pulse was 44, so he seemed comfortable in that sense. He had bilateral cataracts. He was super sweet, but he was missing a lot of his teeth, and he was a pretty poor body condition score. So we took some dental radiographs, and we did an ultrasound, and he had some pretty significant changes on ultrasound. And if you watch the footage, you'll see that. His left side of his heart was kind of squishing the right side of his heart. So if you look at it on the ultrasound, his left side is taking up like this much of the image, and his little right heart like that much. So he had some pretty significant.
Regurg.
Yeah. There's a lot of green when we look at the color part, and you want to see a little bit of green because the ventricles have a lot of pressure. So you're going to see a little bit, but that much was pretty phenomenal to see. And there was a lot of hypertrophy in the left side. So if he wasn't in end-stage heart failure yet, he's getting really close to it. So given all those factors, he was given last act of kindness.
We didn't write his BCS down, but he was pretty close to a 1. He would have needed careful refeeding.
Yeah.
He was just real sweet old man.
He was. We got a lot of really sweet old horses today.
I love this mare. B25-9. B25-9 is only a 9-year-old standardbred mare. She already had a microchip, so we were able to trace her back to where she was from. Super, super sweet. She's blind in both eyes, and in the left eye she has a lot of irritation from an old melting ulcer in that eye, so she needs both eyes removed, which I think we're going to try to get to on Thursday. We're also going to pregnancy check her, do some blood work first to make sure she's a good candidate. Dr. Gina already did the blood work that I haven't looked at yet. So her CBC looks pretty great. Chemistry also looks okay. So we will likely operate on this mare later this week, and I'm hopeful that she'll get to adoption unless we miss something dramatic. But she's a really good girl. She just can't see.
B25-10. Is this the baby?
Yeah, she was a yearling.
Okay.
I don't even think she was a year old.
So she was a pretty young little filly. I didn't get to look at her, but I saw her through the window. And she had severe bilateral hind limb DSLD and fetlock touching the ground in her left hind. So to be that young and already have that significant amount of breakdown is pretty heartbreaking.
She had severe bruising on her joints all the way up into her heels, just like full bruises.
Poor baby. So she was given last act of kindness.
B2411 is a 24-year-old mare. We called her a draft cross. She's kind of a liver chestnut. She's a little bit darker than a normal Belgian color. She has profuse, watery, malodorous diarrhea. So she has very, very severe diarrhea. She has hyperperistalsis, so her GI sounds are elevated in all 4 quadrants, which is consistent with watery diarrhea. Our big concern with her is she has a large, like 1 foot by 1.5 foot plaque of pitting edema, which feels exactly like memory foam. If you push in there, it kind of holds shape. So pitting edema or ventral edema can happen for a variety of reasons, but it basically indicates that the body is leaking fluid out of the places where it's supposed to be into places where it's not supposed to be, and it can be an indicator of end-stage organ failure. It can be an indicator of a lot of things. Sometimes it's not a big deal. Normally it's not great. So we need to do a lot more work with this mare to try to figure out what's going on. We're running blood work on her. We collected a fecal sample. So we dewormed her. We held off on doing a bunch more with her today. I didn't want to vaccinate her because she has a lot going on. And we did keep her separated with just one friend just in case she has something contagious going on with her diarrhea.
B2512 was a 20-year-old mare quarter horse cross. BCS 2 out of 9. She was a bay with a star. It looks like her cardiac auscultation was within normal limits. Her GI was within normal limits. Her respiratory rate and effort were elevated. She had a locked jaw, so probably some dental pathology. And she was severely lame in her left front and right front. Noted she had scars around her vulva, so she probably had a few babies at some point. So we did some radiographs, and it looked like severe hoof overgrowth neglect resulting in right front coffin bone pointing straight at ground. So she had some rotation there. Notable to stand without toe.
Poor Dr. Gina's trying to read my handwriting.
But she was severely painful, and she had that rotation and loss of her right front suspensory apparatus. So with all that, she was given last act of kindness.
This is the mare that had, when she was trying to stand, her toe was like a full inch off the ground, and then if her foot was on the ground, her whole pastern and carpus kind of had to knuckle over.
Poor girl.
And it had been going on for a really long time. Oh, this little pony. I didn't write an age down for him. This is an old pony, B2513. He's probably in his late 30s. This poor little guy, he's missing most of his right ear. He's got scars all over and basically a shredded eyelid on the right that looks very old. He's blind in both of his eyes. He had inspiratory wheezes. He has hirsutism, so he likely has Cushing's disease. He's just has a lot going on. His heart rate was only 50, and only 50. He had also some abnormalities in his hind legs that we noted, but it's really hard to tell. He was so filthy dirty covered in mud that we couldn't tell if he had a mass on his penis or if it was just mud, or if his legs were really swollen or if it was just mud. We did the best we could with palpation. So we're gonna run some blood work on him. I'm concerned that he has metabolic disease, but overall he was pretty stable for today. So we're gonna do a better lameness exam. We're gonna look more closely at his right hind leg. It's a big surgery to remove both eyes, but as long as he's a good surgical candidate, he would need both of those eyes removed. I didn't get a great look at his teeth. He has some major compromise. He basically has no incisors. So he would be one of those hospice, very short-term adoptions, but we want to give everybody a chance, and he was stable for today. So we'll see how his blood work looks.
B2514 was a 21-year-old standardbred mare. She was also a bay with a star, and she was branded. Looks like her left hind, oh yeah, she failed proprioceptive placements. She failed the tail pull both sides. She was crossing over in the hind limbs, and she had difficulty encircling. So when we were doing proprioceptive tests, it's a very abbreviated neurologic exam that we did today, but normally you do a bunch of different scenarios and speeds and directions and everything, but watching her walk and then doing those kind of concreted that in our minds. She had inspiratory lung sounds bilaterally, and she was very reactive over her withers. She had some mucopurulent nasal discharge, so we got a swab. Some of the horses today, we just got swabs whenever we noticed that kind of a thing, so she was one of them. But with all those signs and symptoms, the last act of kindness was the best thing we could do for her.
Yeah, neurologic disease
It's rough.
not a lot of great options for prognoses. B2515 was a 34-year-old standardbred gelding. He was black, and his body condition score was a 1 to a 1.5. He was very, very thin. He had a heart murmur that you could hear on both sides of his chest, and he was basically missing all of his teeth. He had no incisors, and he had no functional occlusal surfaces, top or bottom, on either side of his mouth. Even trying to take treats, he couldn't get the food into his mouth. So he was functionally starving to death even if people were feeding him. So I recommended the last act of kindness for him because of his severely low body condition score. He was at risk of refeeding syndrome. He also had cardiac disease. And then I also wrote respiratory disease, but I didn't finish writing my notes down. He had some elevated lung sounds as well.
B2516 was...
Oh yeah, this was the big lick filly.
Yeah, 3-year-old Tennessee walking horse filly. She had her tail tendon cut, but her right hind limb, her pelvic limb, was completely abnormal. She had lots of atrophy. She was kind of dragging it and placing it oddly, and it was shorter than her left hind, so whenever she would move, she would kind of dip on it. So because of that, she also had mucopurulent nasal discharge, so I think we got a nasal swab on her too. Given that neurologic exam versus chronic pelvic pain, pelvic injury, the last act of kindness was decided for her just because it was so severely affecting her that she wouldn't have had a very good quality of life.
B2517. This guy's gonna need a miracle. But he is gorgeous. He's a 3-year-old stallion. We did confirm that he has both testicles. We were concerned he might have been a cryptorchid. He is not. He's just gorgeous. He's a 5 out of 9 body condition score, so really well built horse with a great personality. He had came in with a wrap on his leg, and when we took the wrap off, we were like, oh, okay, just some granulation tissue, doesn't look terrible. And then we took some radiographs, and what we found is that there's a pretty large, probably like 3-inch by 2-inch area of pretty significant periosteal reactivity. When bone encounters trauma, the cells lay down new bone, but what can happen is it can create a situation called a sequestrum, which is what Dr. Gina and I believe this guy has. A sequestrum happens when little pieces of devitalized bone act as a chronic nidus for infection. So the body is like, there's something abnormal in here. So whether it's an actual like bacterial infection or it's just a chronic source of the body thinking that something is in there, kind of like a foreign body, basically. I think he has a decent chance of a full recovery, but he needs major orthopedic surgery, and I don't feel confident tackling the surgery. He needs bone curettes to basically remove the affected area, and then the whole area needs to be debrided and closed as much as it can. So the proud flesh part, no problem. Our team can tackle that. We also don't have a full picture of soft tissue, but he's clinically sound. He's walking around on the leg, no problem. And he's 3 years old, great personality. He does need to be castrated. But in my opinion, he would need referral to a surgeon, which is all the money. We don't know what it would cost. So we're going to try to send some images to some of our veterinary colleagues and see if we can find out more. We try to be really responsible with the resources that Horse Plus has, because our primary mission is to rescue horses out of the slaughter pipeline. And unfortunately, we don't get a lot of things that we can fix. But if we have a young horse and we can have a surgeon that says, sure, if you can come up with X dollars, I can feel pretty confident that this animal could have a great quality of life, we're going to fight for that. So he is stable for now. We're going to run some blood work on him just to make sure he doesn't have a raging infection, but in my opinion, he's very stable, and the reason why he still has that draining tract is that sequestrum. So it's a really interesting radiograph. We don't see a lot of these, and it's a long shot, but I'm hopeful. We're going to give it all we can.
B2518 is a 21-year-old gelding standardbred, branded. His heart rate was 56 today when we examined him. He has bilateral hind limb DSLD, left hind was swollen and effusive, blind in his left eye that needed a nucleation, and he had pain on palpation over his withers. He got Banamine. Like she said, anyone who's painful gets pain meds. But because of his DSLD and all the other things going on with him altogether and being refractory to our pain management, the last act of kindness was recommended for him. Bless his heart. You sweet.
We see a lot of DSLD, deep suspensory limb desmitis. It is chronic, progressive, incurable. Can be managed at earlier stages, but kind of the best you ever get is just maintaining where you are, not backtracking, so that by the time they have progression of that disease and are already painful, there's not a lot you can do. B2519 was another standardbred gelding. He was 23 years old. His body condition score was a 3 out of 9. This poor boy, he was also blind in both of his eyes. He was very responsive and kind to people, but he was very fearful of sounds and being separated from horses and walking through things. So I think he had a pretty rough time of it. His right carpus was visibly and palpably swollen. He was also lame on his left hind leg. And then he was kind of over at both knees, and he actually was lame on both left front and right front. He had a lot of severe hoof overgrowth and neglect, but he also had a base-wide stance in his hind legs. Unfortunately, he also failed proprioceptive placing in his hind end. So in addition to being blind and having a lot of fear for what was surrounding him and being lame in 3 legs, he also had evidence of neurologic disease. He had several instances where he just showed that he didn't know where his legs were in space. He was afraid to come out of the shoot, and we realized it was because he couldn't get his hind leg to move because there was a little ridge there and he couldn't tell that it was there to pull his leg up over. And so we recommended the last act of kindness.
B2520 was a 25-year-old gelding quarter horse, sorrel boy. Yeah, he's real cute. His heart rate was 44. He had pain on palpation of his withers, his thoracic and lumbar spine. He had scars over his withers, bilateral cataracts, nasal discharge. He had a wound or scar on the medial dorsal left hind with a fusion in the left hind. He was missing a lot of teeth. His teeth were worn right to the gum line. He had lost a lot of body condition also. He was probably around a 2 or 3. We didn't write it down, but remembering him, he was pretty skinny. Also, watching him walk, he was off in the hind, so Dr. Lydia did the tail pull test on him, and he failed those proprioceptive placing tests as well. So all of those things with him, the last act of kindness was what we all agreed upon for him.
He had just given up. That horse was just like...
Yeah.
The last horse we received today was an owner surrender. Her name is Snow Baby, which I think is adorable. That's her registered name. She's a little quarter horse. She was born in 2010, and we didn't actually get the chance to hands-on examine her today because once we're up in quarantine, we are contaminated. So owner surrenders we treat a little bit differently. She's also quarantined from our general population horses, but we didn't do a full exam on her today. From what we know of her, she is difficult to catch. The lady spent a couple weeks trying to catch this horse in order to bring her to us. And Haley said that once she's caught, she's super sweet, but she seemed really footsore in her front feet. So we'll make taking a closer look at her a priority, but that is all we know for now. And she is turned out to decompress. And that was it. That was our whole buyout group. Thank you guys so much for your support of our buyout program. It's pretty hard to do, but like Dr. Gina said, we had a lot of horses that really needed our help today, and we were able to help them, give them pain medication and assessment that they needed. And we're hopeful for the ones that we were able to save today that we can get them into their forever home. So thank you for your support, and thanks for watching this debriefing.